Clint and Jay for having me here tonight. I am very excited and I'm also very honored. I grew up in the Bahamas, and being indigenous to the Bahamas, anytime you got sick, the first thing you did was they used bush medicine. So I was always tied to nature. It was ingrained in my DNA to look at the body, to look at health, to look at whole body health. I have a practice in Alameda called the Wellness Center. And in that practice, my focus is on whole body health. I cannot understand dentistry not looking at the whole body. The mouth is intimately connected with the rest of the body. In saliva, you may not be aware that there are enzymes and proteins, particularly to protect the body from harmful effects. Everything starts in the mouth. Digestion starts in the mouth. And as I started getting into dentistry, I wasn't satisfied by what I was being presented with at dental school. I graduated from Marquette University in 1985, and at Marquette, we were told that the key reason for fluoride was because it protects you from tooth decay. Well, that just didn't sit well with me. As I went further and journeyed into my profession, I actually did some studying in naturopathic medicine, and my premise is to protect the blood. So we were taught to let food be your medicine and medicine your food. As I journeyed through dentistry, I really started to understand the systemic effect of cavities. It wasn't because of the reasons that was given to me in school, but I started understanding pH. And pH is the key to causes cavities. And so I couldn't sit well with me understanding why are they pushing fluoride as much as they are. My practice deals with sleep. It also deals with the brain. It deals with osteopathy. And as I started working with the brain, I started understanding key areas such as the hypothalamus, autonomic nervous system. The hypothalamus, for most of you who may not be familiar with it, regulates 90% of your systems. Hormones, calcium magnification into the system to allow absorption. And many times when you introduce fluoride into the mouth, fluoride mitigates enzyme activity. Something very simple, such as white blood cell activity. There's a term I'm going to use for you, for those of you who may not be familiar with the term. It's called phagocytosis. Well, fluoride reduces the efficacy of phagocytosis. So this is a major protective mechanism. I'm going to digress a little bit. As you go back to the brain, there's an area in the brain, and the cerebellum has these Purkinje fibers that has a relay directly into the pons of the medulla, which is in the brainstem. Well, the mouth is intimately connected with this area of the brain because there are relay stations from the brain that goes directly into the tongue and goes into the mouth. So anything from the mouth can go directly to the brain, and anything in the brain can go directly to the mouth. When you introduce fluoride into the mouth, fluoride right away causes enzyme reduced activity. So right away, your protective mechanism, your immune system is being impacted. So as providers and as leaders in the community, we ought to protect the public at large from anything that can damage the brain. The brain is number one. The brain is the engine of the human body. Today actually is Water Day, World Water Day. And for most of you who may not be familiar, the brain is actually 80% water. And without the blood, you and I would not be standing here or sitting here today. So it behooves us to be aware of any contaminant that we can put into the mouth that can have high levels of absorption and affect the system. There's a cranial nerve called the vagus nerve, for those of you who may be a little bit familiar with the body, that goes from the brain and affects the autonomic nervous system. These are basic functions such as digestion, elimination, your sleep. Your sleep mechanism is the key reason why we wake up, we are able to function the next day, we're able to fight and combat diseases. Without sleep, there's no ability to heal. And so fluoride, again, mitigates a lot of the enzyme activity, a lot of the medicaments that protect us. And a very simple one is the enzyme phosphatase. Phosphatase is key for allowing calcium to be utilized in the human body. calcium is one of the key essential elements that keeps us strong. It affects the soma of the spine, it affects the head and neck, it affects our legs, our arms, all joints, and it's the key for the teeth. So I couldn't understand why would we introduce an element into the mouth that's going to counteract the basic property of the human body, which is the skeleton. The other thing that didn't sit too well with me again is its effect on the white blood cell. So for those in the population that are dealing with AIDS and autoimmune disease, and taking in and ingesting water or fluoride, right away reducing their immune defense mechanism. So again, there are many episodes of fluoride that just didn't sit well with me. So as I journeyed in my dental career, I had to take a step back and really analyze, why am I using something that I can see black and white, that this is totally against the efficacy and the strength of the human body. The blood is number one. The human body is in communion with the blood. Anytime you contaminate the blood, you're now diminishing your immune response and you're diminishing your health. So that was very clear to me that I had to change the gamut of my practice. And so I want to share with you the key things to take away from my talk today is the oral environment is intimately connected with your health. Anything you put into your mouth, within seconds goes into your general circulation. I'll give you a good example. If you were to pass out and the paramedics came to get you, the first thing that they do when they discover that you're not coherent is they many times put nitroglycerin under the tongue. Within 30 seconds, nitroglycerin can accelerate the heart. So just think about it, the impact of nitroglycerin in the mouth within 30 seconds is now igniting the heart. So don't you think that if you introduce fluoride into the mouth, within seconds that's going to impact your general circulation? And many people don't think of it like that. But I always try to reduce it to basic things such as that, because through those paradigms someone can understand, what are we doing? What are we introducing into the mouth? The heart, bacteremia from the mouth, shows up in the coronary artery. Most of the bacteria that they're now seeing that is impacting the heart is from the mouth and the gums. Anytime you introduce high levels of fluoride in the mouth, right away it has an impact on teeth. It changes the cellular structure of teeth. Some of you may be familiar with the term fluorosis, but right away, the minute I see that it is not fluorosis, I'm now saying a cellular change, because this isn't changing the cellular structure of teeth. Without teeth, you're now impacting your posture, because teeth are more than for eating. Teeth is key for circulation. The carotid artery, which is key, makes 2 90-degree turns around the TMJ. Fluoride impacts bone. Fluoride weakens bone. And so many times when we have issues such as numbness, we can't sleep, we have dizziness when we stand up, and someone doesn't understand, why is my skeleton changing? We must look beyond the physical skeleton. We must look at the nutritional content of the blood. We must look at the chemistry of the mouth, because all of these things are parameters. So when you take teeth away, you're not just removing teeth, you're now impacting your blood. And that's why my premise is do no harm to the blood, because it's more than just the teeth, it's more than just the bone. Women deal with osteoporosis and a lot of bone degradation. Fluoride significantly impacts bone, it weakens bones. And so, because my practice is centered around TMJ and health, anything that's going to be counterproductive to bone gets my attention immediately. Because I deal with the whole body, not just the teeth. Again, the oral environment is intimately connected with the rest of your health. And as a public servant and anyone making decisions that's going to affect the public at large, we must look at the whole system and what is this doing to the public? What is this doing to whole body health? And that's why I changed the nature of my practice. And so, if nothing else you that I said today that you may leave here with, is to understand that whatever you put in your mouth, within seconds, goes into your general circulation. So, you cannot separate one without the other. You cannot separate the blood without the brain. The brain drives the body. And there are direct connections from the brain that ties directly into the tongue. And the minute you affect the mouth, you're now affecting the organ structure. And the last little scenario that I'm going to share with you that is all teeth connect to an organ system. So when you see fluorosis or you see a damaged tooth, I go right away to the organ system that's affiliated with it. For instance, your two front teeth, which we call in dentistry teeth number 8 and 9, they actually connect to the bladder, the prostate, and the kidney. So if you damage these two front teeth, it isn't just the teeth, it's the organ system that they're connected to. I had a patient in my office had significant problems with tooth number 14, which is on your upper right molar. And I kept saying to her, that needs to be addressed. And she ignored my recommendation. 5 years later, she actually ended up with cancer. And again, I said to her, all teeth connect to an organ system. And when she first started getting sick, I said to her, not knowing what she was dealing with, that teeth is actually connected to your breast. The lady actually ended up with breast cancer, is no longer with us. That is how significant the mouth is. So you cannot ignore the teeth. You cannot ignore fluorosis. You cannot ignore anything that you put into the mouth because it will impact your health. Thank you so much.